Okay, good evening, everyone. There's still a few people joining, but I think we can start with the introductions. Tonight is a very special night. So these CPDs are normally focused around research and clinicians and the mechanisms of diseases and how we understand these and so on. But tonight, we are privileged to get a patient's perspective on a rare disease and living with a rare disease, cystic fibrosis to be more specific. And I think this will be maybe a first to some clinicians and researchers because we tend to see patients once a month, once in 3 months for a short period because you need to see a lot of patients. And it's really rare that you can actually hear a story of someone's entire life and other patients' entire lives and how they live with this rare disease. We have a privilege of having Maré Smit here as a speaker tonight. Maré is an occupational therapist with over 15 years of experience working in both private and community-based settings. Driven by compassion and a deep sense of purpose, she is dedicated to improving the health and well-being of children, families, and individuals living with cystic fibrosis, a condition she personally understands. After graduating with a bachelor's degree in occupational therapy in 2006, Maré began a career at the Cape Mental Health Society, where she developed and implemented training programs to support adults with intellectual disabilities in finding meaningful work opportunities. Her career later led to manage a multidisciplinary therapy center where she trained and guided a team of 17 professionals and developed early childhood monitoring programs for both private and community environments. In 2017, Maré founded the Et al. Therapy Center, focusing on holistic child and family development, and has since managed large-scale community projects such as the Akker Fikele Leila project, which ensures school readiness for children from disadvantaged backgrounds across 16 schools. As the director of Breathtaking Fundraiser NPC, Maré is committed to advocacy and systematic change, striving to ensure equitable access to treatment and care for all individuals living with cystic fibrosis in South Africa. With her strong communication skills, project management experience, and deep empathy, Maré continues to make a meaningful impact through her work, empowering communities and advancing health equity. We would have had another speaker tonight, Juanita Biggs, a psychologist. Unfortunately, Juanita fell ill and couldn't make it tonight, but Maré agreed to step in and stand in for her, and she will give you some of the presentations that, or some part of her presentation would be to tell you what Juanita would have told you. Juanita will be in a different session, but we will communicate that. She might be returning for her session then at a later stage or next year. If you have any questions, even if it's throughout the talk, you're welcome to post these in the chat function on the Q&A function that you'll see at the bottom of your screens there. We will not answer these questions throughout the talk. So we will just let Maré finish up the entire talk, and then we will take all the questions and answers. If you feel that you have a more difficult question or a question that's more difficult to type in a few sentences, just raise your hand. So there's a raise hand option as well, and I can unmute you, and then you can ask your question live. Yeah, so without further delays, thank you very much, Maré. I know it takes a long time to prepare for these presentations. People tend to think of it as just an hour of their day, but for you, it was a few days to prepare. Thank you very much for taking your time, and we are looking forward to see your presentation. Thank you.
Thank you so much for the opportunity, Ilse, and welcome everyone. Today we're exploring cystic fibrosis from a very personal angle, and that's the patient perspective. As we dive into this topic, let's remember a profound quote. Life is not measured by the breaths we take, but by the moments that take our breath away. I'm Maré Smit, and I'm an occupational therapist, but also the director of Breathtaking Fundraising, NPC. And I would like to share with you some valuable insights through the lens of those living with cystic fibrosis. And it's crucial that we view not just cystic fibrosis as a medical condition, but also as a journey filled with unique challenges and inspiring resilience when we do work with patients with this disease. As we move through this session tonight, please keep in mind the incredible strength and determination of those who live with cystic fibrosis. Let's just see. As we explore the patient perspective, let's just focus on 3 key areas: the challenges of comorbidities, the impact of social and economic circumstances, and the importance of strong support systems. Firstly, patients with cystic fibrosis face a range of comorbidity challenges. It is a multi-organ disease that affects not just their lungs, but the GIT tract, often leading to CF-related diabetes. It affects their lungs and liver, kidneys, and so much more on a mental level as well. I think it affects their daily lives and in essential also their treatment plans. This variability can actually complicate the ethical decision making, as each case requires a nuanced approach. Sometimes it's better for the patient to receive home treatment, other times it's not possible due to cross-infection challenges and risks. Secondly, the social and economical factors play a crucial role in a patient's journey. These circumstances can actually influence access to care, as not everybody can afford medical aid in South Africa, and patients in the state don't always have access to all the medication that should be prescribed or are effective for cystic fibrosis. That all affects the overall well-being of patients, and it's essential to consider these factors when we plan treatment and support for our patients. Lastly, a robust support system is invaluable. It not only helps the patients manage their condition, but it also provides emotional and practical assistance. The insight patients have into their disease also varies widely, and there's very few CF specialists in South Africa. Patients have told me that sometimes they have to travel 8 hours to see a CF specialist. And this all adds to how they see their disease, how they see their prognosis, and very importantly, how are they actually doing their treatments? Are they doing their treatments? And so I think insight into the disease is so important. I want to share a few examples just with some of the stuff I've mentioned above, and that's my own support system. I would not have been able to do as much as I have been able to do to fulfill a career and also have lots of friendships and spend time with my family as I have in the past and as I'm currently having, if it wasn't for my support system. I need them to assist me physically sometimes. There were times where I had them to help me get dressed when the pain is too much. There are times when I had them in hospital with me to help me take care of my children so that I can receive my treatment. I will get into more detail a little bit later on that topic. In discussing the role of parents of children with cystic fibrosis, it's crucial to acknowledge the uncertainties parents face. Variations in healthcare can complicate feelings of denial and acceptance, which are both normal. I think it's important to note that the healthcare system and how it plays out and how patients have access to the healthcare system also differ from province to province. It's much easier to have access to a CF specialist in Gauteng or Western Cape than it is in the Eastern Cape, for example, and there's no CF specialist in 4 provinces. There's only CF specialists in 5 provinces in South Africa, which really makes it hard for patients and especially for their parents to navigate the healthcare for their children. This causes a lot of anxiety and fear, especially on the parents. So I think it's very important to connect them with another family that can provide them with invaluable support through shared experiences and practical solutions. Just how do I help my little child to swallow a tablet? How do I get them to eat more fatty food that goes well with Trikafta, for example? How do you go about when going to hospital? How do you make it practical? How do you survive it? How do you go through it with as less stress as possible? This is why it's so important and crucial to connect families, especially those that have gone through some of the obstacles and challenges before and that actually seem to cope well or have good support systems. Those are the ones that you want to link up with those people who don't have support systems and that can do with some extra encouragement or some advice to make things work practical. I think counseling should be viewed as a helpful resource, fostering a sense of responsibility but without fear. Please remind parents that they are not alone. Embrace taking one step at a time. They are capable and resilient together with their child that have cystic fibrosis. Together we can create a brighter tomorrow with families. I think they need to know that they are not alone and we are all part of a bigger community. And this is one thing I've seen, and I've also heard many CF patients testify to it, that the CF community is such a supportive community. I've seen how patients reach out to one another, support with either medication that they ran out with and they currently need it very urgently. Sometimes they need some practical assistance with something. Sometimes it's just about what specialist to see, what treatments are available. I think it's important to know that there's not sufficient knowledge out there. It is a rare disease and it's very hard to navigate the route and what to do, how to keep your child safe against cross infection, but still be socializing, still be part of a bigger social circle and family. I do get a lot of questions from parents asking me, how can I still attend the braai without my child starting to cough? How can I prevent my child from being sick the whole time or getting sick and hospitalized? So I think it's very important when physicians do work with patients who have cystic fibrosis and their parents specifically to guide them and be very practical about how they can go about without having fear of getting sick the whole time, but having the risk of getting cross-infected diseases. Let's explore how patients can eliminate our understanding of their journeys. Patients provide invaluable insights into the burden of illness. They help us grasp daily life with their conditions. They can identify key outcomes, balancing treatment benefits, but also some drawbacks or challenges that they have. And that's essential for creating effective care plans. They are also the ones that can highlight unmet needs within the healthcare system. And that guides us towards a compassionate solution. Let's consider their input as a bridge between scientific evidence and making decisions when we plan our treatment care plans for them and ensure that our actions are both informed and impactful. Let's value the clarity that patients offer when we are navigating healthcare challenges with them. Let's take a moment to listen to patients' experiences. Many feel overwhelmed by sputum, isolated, anxious, and fearful, impacting their quality of life on a daily basis. I think there will be some questions at the end, but I will actually elaborate on some of these just now. Their pain is both physical and emotional, and sometimes leading to PTSD. Feelings of being a burden can numb patients. It can numb their emotions and their drive to do something meaningful, follow a career, go to school, make friends. And it also highlights the need of support and empathy we should have with our patients. This feedback calls for action to improve care. Patients' insights are so essential for understanding their experiences better. Being a patient myself, I think it's important to share with you just some feedback that I also experienced because I know to many of you I might look really healthy. So please be aware of the fact that cystic fibrosis is known as an invisible disease. And I've experienced this so many times. There's this whole disconnection that happens. And another patient shared their story with me, their experience with me. And at the age of 42 was the first time I realized that is something that resonates with me. He went on to explain that sometimes when he looks at the papers and he looks what the doctor says, and when he looks at how he feels and how tired he is, how extremely difficult it is to get daily tasks done. But when he looks in the mirror, it's a different picture, because when he looks in the mirror, we look healthy, we look good. But on the inside, not everything is functioning as it should, and it really makes life extremely hard. And not just that, it affects the quality of life we have. I can remember when, before I had access to Trikafta, I think it's important to mention that I wasn't able to sleep up at night, because as soon as I went to lie down, I struggled to breathe. It felt like I was drowning. And not only at night, actually throughout the day, when I had conversations, I really had to grasp for air. And there were moments at the age of 39 to 40, just before I had access to Trikafta, where it was really hard to be social, because the moment I started talking, wanting to take part in a conversation, or when I wanted to present a group of students, postgraduate students, it was just impossible to finish and complete the sentence without breaking out in an intense cough, where everybody thought, okay, she's going to pass out any moment. And I think that makes it hard. You start to actually isolate yourself, because it's hard to then participate in conversations, and you become an observer in most social circumstances. This is obviously the same for younger patients. It just gets worse as we get older for many. But I think it's important to take note of, this is a disease that, even looking as healthy as I look to you now, it actually is quite impactful, and makes it hard to have quality of life just having conversations. Sleep has a definite and a direct impact on how you experience your day, your energy levels. And then lastly, I want to also stress out some, or just explain some PTSD symptoms that I've also experienced. And I explained it to my specialist the other day as well. I think the moment somebody starts coughing next to me, it triggers a PTSD effect in my body. I immediately think I have to get away. Everything inside my body feels like it's got to get myself away from the situation, to protect myself against cross-infection. I don't want to end up in hospital. So there's a whole cascade of emotions coming that I don't have any proper control over unless I go for therapy and I sort that out. Then it does get better. I think part of it I will get back to later, as to say how you, as a specialist working with patients with CF, can actually help reducing that stress, and as far as possible. It's not always possible, but there are ways that one can lessen the stress on patients. And the last one that's on the slide is also feeling like a burden. Patients have been feeling like a burden even from very little. They realize that the family has to take extra care. There's a lot of inhalation, nebulizations, doctor visit, hospital visits, and they realize when they have siblings, there's a lot of time going into their treatments, and that the siblings are missing out on some valuable time with mom and dad, and they might start feeling like a burden as well, but also financially, because it costs a lot of money to ensure that a patient with cystic fibrosis actually can receive proper treatment. I also want to emphasize the uniqueness of each patient's experience with cystic fibrosis. When you have a patient and you work with cystic fibrosis patients, or any other chronic disease for that matter, I think it's important to ask your patient, what is it like to live with cystic fibrosis for you? What is it like to live with the specific disease you have? What is it like for you? What is your experience with therapies you currently are doing, but also past therapies? And also make sure you understand what their expectations are, so that you can also use that moment to educate them and inform them and build trust with them. I think it's important to ask what will make life easier for you, especially if there's a hospitalization coming up or IV treatment coming up for the patient. Ask those questions, even if there's nothing you can do, but sometimes you will be surprised at how much you can do to make life easier. And I'm going to use the next one to explain to you what amazing difference my own specialist made in actually empowering me to do something about my own family roles that I have while receiving treatment for cystic fibrosis. And I think what happened is I had a very young baby. I was a young mother and I had to receive IV treatment being hospitalized. And at that moment, I had an IV line in my arm, and the doctor said, Marie, why don't we get you an A port? That will free up your arm so that you can take care of your baby. That was a true game changer for me. Something small like that made life so much easier for me, because from that time on, I was able to receive my treatment, take care of my health as best as possible, but also fulfill my role as a mother and as a wife to my family. And I think it's very important, because that things that people do, that things that are part of their daily lives, the roles they fulfill, are so important and forms part of their identity. And we must rather empower our patients than make them feel that they are a burden or they are not worth doing anything or not able to fulfill their roles. Let's talk about our youngest group of patients, and that's our pediatric patients. These are our babies and children who, like all kids, need clean air, healthy food, nutrition to thrive. And it's crucial for them to have opportunity to play, feel safe, and have the space to move around and develop optimally. This is obviously hard when a baby has to be hospitalized, but if you take these things into consideration, find ways to work around it, it is possible. One of the key challenges we face is balancing the need to prevent cross infection while also encouraging social interaction. I think it's so important for the clinician or the CF specialist, or even pediatricians who have patients with other diseases, to be practical in guiding families on how to gauge this and ensure that the child is safe, free to explore, but still develop optimally. Children need to be around other kids to play, learn, and socialize. It's very essential for their development. As Abraham Maslow wisely said, play is the work of a child. Play isn't just fun, it's vital. It's part of growing up and development. By focusing on life specific stages and interventions, we can actually significantly improve the quality of life and adherence to therapy and treatments that patients receive. As teenagers, the need of peer interaction is a central part of life. It's crucial that we help prevent them to isolate themselves while guiding them to find a balance between independence and responsibility. Be sure to explain to them what the consequences would be of not following through on therapy protocols. Be sure to explain it in detail to them so that they don't feel you're withholding information from them, but also so that they can be empowered and know that you trust them to also take that responsibility. Let's acknowledge that it's okay for teens to experience a whole range of emotions. As Molly Barr pointed out, positive vibes only is not a thing. Humans have a wide range of emotions, and that's okay. The goal is to support them in navigating these emotions healthily. Life stage specific interventions are key into improving your quality of life and adherence to therapies. Every stage presents unique challenges and opportunities, and it's our role to support and provide whatever the patient needs. I think in my discussions with teenagers, I would like to share with you the following. And that's a feeling of being a teen feels like no one understands me. But being a teen with cystic fibrosis feels like you're an alien and everything is against you. It's really hard, and most of them feel alone. I think because of the risk of cross-infection. They don't necessarily socialize with other teenagers or people who have cystic fibrosis. I know this is true for many patients and also a true risk for many patients. And in the end, they feel so alone because they cannot identify with anybody else who has similar challenges. It's just really hard to navigate being a teen and having cystic fibrosis and finding it so hard to get through your day. And there's a lot of anxiety about what this disease will hold in the future for you. And is it worth it even to fight for your life? Will you be living to go and study? Will you even, who wants to date a person who might not live that long or really struggles to get through their task every day? As we transition into discussing young adults, let's focus on three key areas: career paths, intimate relationships, and managing stress related to hospitalization. Firstly, a realistic career path is critical. I think as a specialist, you can point out any risks that a particular career might have for a patient that they didn't think about. And then also, it helps them if you sit with them, discuss their future options, and have a clear goal, something that's achievable for them, so that they can navigate through this part of their life, but with confidence. It's really hard for young adults to even bring it up in an interview that they do have cystic fibrosis, because if an employer would actually have to Google the disease, it's not really somebody you would want to employ, because if you look on what's out on the internet, you would think, what's the chances of this person coming to work? They would often have to be hospitalized, which is true for some people, but not everybody. And also some works can actually have flexibility, and that should be discussed prior to choosing your career. And I think a specialist could really participate in discussions with their patients and families about that. Next, the importance of intimate relationships cannot be overstated. These connections shape what the future holds for the patient. I think it helps them to build a sense of identity and belonging. And those are crucial actually during this life stage. That person who will spend their life with a patient living with cystic fibrosis will form such an important part of when life gets tough and when the patient has to think, okay, how am I going to get through this? It helps if there's somebody else in the boat with you, encouraging you when things are getting tough, and taking your hand, and so that they don't feel alone going through these tough times, which does happen with cystic fibrosis. Next, we must address the stress that comes with hospitalization. It's important to have open discussions with your patient and discuss things like, what are the embarrassing symptoms you might have with regards to sex, family planning, your appetite, digestion. Share these open communication and topics with your patient. Be sure to know what their struggles are, what they are worried about. I have found that a plan of action discussed prior feeling unwell really helps, just lowering the stress a patient might have and the anxiety around what to do when they are falling ill and feeling unwell. As a young adult, I can remember so well that the discussions we often had with my specialist would be, how is life? What is your work expecting from you? How are you coping with your job? Is there anything else you need? I can remember a few times where my specialist would actually say, what do you need from me for this hospitalization? Sometimes it's a motivation, sometimes it might be a sick letter, whatever the case may be. And I think it's important to look at all of those and how to make it easier. As adults, we often find ourselves juggling multiple roles: career, health, family life. Amidst hospitalizations can be really stressful. And I think let's consider how roles and responsibilities impact this balance and how we can manage them effectively. One critical area is keeping ourselves safe from cross-infection, which requires vigilance and also protective measures. I think it's so important to safeguard our health, because if we can stay as healthy for as long as possible, protect our lungs against unnecessary bacterial infections, we can prevent long-term damage and have so much better quality of life as we grow older. Additionally, adults face more and more psychosocial challenges, and that affects their daily quality of life. We have to address these challenges head on so that it will maintain their well-being. Quality of life is not just a concept. I think it's a fundamental part of our daily experience, and it deserves not just the patient's attention, but also our healthcare professionals' attention. I think I have also learned ways of coping and making quality of life better through using my support system. Whenever I'm able to do something, I will definitely do it. And whenever I ask somebody to do it, I have explained to them, whenever I ask you, just know that it's something that I was not able to do or I couldn't do at that moment. It's not because of laziness or the fact that I don't feel like it, but that empowered me to communicate what I feel like, what I'm currently struggling with in my life and health-wise as well. But also it helped me to accept help and support from others. And that in return also makes them feel that they are actually making a difference in someone else's life. And that is a little bit of a gift that we can give to others. For this slide, we're focusing on aging patients. Let's highlight 3 key aspects. First, recognize that only 10% of patients were older than 55 years during the CF data registry that was done in 2023. I know this will be a little bit more in the years to come, since people are getting access to Trikafta slowly. But I think our older patients have to often deal with comorbidities such as arthritis, heart disease, CF-related diabetes, cancers, liver and kidney disease, and so much more. They are also possibly facing regrets of careers they couldn't follow that they wanted to do, maybe studies they wanted to do, hobbies they wanted to do that they were never able to do, and they might have insufficient pension. I think all of that adds to their stress. They need a specialist who is both thoughtful and caring. Finally, I think it's important to acknowledge that these patients are often more experienced than many nursing staff when it comes to administering IV treatment, for example. And I think what I want to explain here is when you are in hospital and you have to watch or observe how a nursing staff is actually busy mixing your medication but not following the cross-infection protocols, that actually causes a lot more stress to a patient. And so I often myself have been granted permission to administer my medications with a nursing staff rather observing or even learning from me. And this is just not just because I have done this so many times. And I am in fact actually the only one who has to take care of my health as well. The responsibility also starts with me, but it also ends with me. But my health specialist and the people on my care team, I can use their knowledge, their guidance to make it possible for me to take care of my own health as best as possible. Remember, the overarching goal here is to improve quality of life and adherence through life stage specific interventions. This requires compassion and understanding from caregivers and also healthcare practitioners. I think let's treat grey hair as a crown of glory and as a testament to their resilience and wisdom. Let's take a moment to appreciate our CF specialists. They are not just healthcare providers. They are our greatest allies. They wear many hats: advocates, comforters, and they are a source of hope. I remember numerous times where I would be stressed out about my symptoms, where the disease is progressing or not progressing, where I'm falling behind. And every time my CF specialist would be the one to help me take the next step, have hope in what's to come, and just stay with my treatments. And they are the ones that actually can give you hope when you feel hopeless in a situation, or when you feel I don't have anything to give anymore. I don't know if I can do this anymore. Your healthcare specialist is the one that actually tells you there is hope, keep on fighting, keep on going. They continuously motivate for improved treatments, and they ensure that every patient receives the best possible care. I have seen this within the NPC and working with various patients. For every one of them, they are so extremely grateful for the extra mile that their CF specialists are walking for them. And this is what I actually wish for every specialist working with patients, especially ones with a chronic disease, that is what your patient would say of you. What truly sets them apart is their approach to treatment. I think they see beyond the disease. They treat the person as a whole. This holistic approach can make all the difference in a patient's life. Remember the saying, the good physician treats the disease, and the great physician treats the patient who has the disease. I think for some, the heartbreaking reality is that they don't have access to effective treatment. And for others, it is a constant uncertainty of when will access to treatment be denied or taken away. And this is something where the specialists really have made such a huge difference when they started motivating for Trikafta with medical aids. And this is now within the CF population and sphere. And we are just immensely grateful for that. Thank you for those who are listening tonight. Let's talk about some questions that the patients often wish that they were asked during consultations. So I think the first question is pertained to patients who have been diagnosed at a much later age. Often patients were diagnosed with celiac disease or asthma. Those are the ones I've heard of in the past. And one of those patients then also said to me, they wish that somebody would ask them, have you ever been tested for cystic fibrosis, and consider doing a sweat test. I think next is consider to ask them what will make hospitalization or intravenous treatment or any other treatment if you're treating another chronic disease, what will make it easier for the patient? Ask them the question. This question is all about understanding personal needs and making the experience as comfortable as possible. Remember, we want to make a difference in quality of life and health in the end, and this is how we can achieve that. Finally, it's important to delve into specific questions and aspects of daily life. Ask patients how their symptoms are affecting their work, exercise, sex life, school, socialization, sleep, and anxiety. Understanding these impacts can lead to more personalized and effective care, and really does make the difference. Thank you for being here today. As we conclude, I'd like to leave you with a powerful thought. Consider the words of the poet. She never seemed shattered. To me, she was a breathtaking mosaic of the battle she's won. I think this beautifully reminds us that each person's journey is unique and filled with strength. Let's continue to see each individual as a whole person and appreciating their resilience and their courage in the face of challenges. Thank you so much for having me. Please visit our website at breathtakingnpc.co.za for more resources and support. Thank you.
Yeah, thank you so much, Marie. That was eye-opening, and I don't actually know how to describe it, but it's more than eye-opening. We have two in the chat. Let me just open it now. So please ask your questions in Q&A or raise your hand if you wanted to be unmuted and take part in the discussion. First is from Jane Venter asking, what inspired you to start the NPC and what does it entail? How can the medical fraternity start being involved?
Thank you for the question, Jane. I think yeah, I think things were going really tough when before I had access to Trikafta, and then when I gained access to Trikafta, my life changed within a week, and it changed so dramatically from being almost bedridden and really struggling to participate in daily activities. And within a week, I was able to breathe much better, much easier, and within a month, I was able to stop my daily physiotherapy sessions. My hemoptysis has gone away literally since the very first day I started with this medication. And why I'm focusing so much on this medication is it made such a huge difference in my life that I realized something must be done, because at that moment we didn't have access to it, and the only way we could get it was to fly to Argentina to get it. And I was seeing how people were so overwhelmed in this community to get access, and many were afraid to travel to a country where they don't speak English at all. To bring back medication that was extremely expensive was another thing. And then also many people aren't able to travel. Some patients aren't able to travel. They are too sick or too young to travel themselves. And I realized something needed to be done. And I think I wanted to be part of the hope that the CF community needed. And as part of that, we started praying about it and having discussions, and we just said life is breathtaking, not just CF is breathtaking. And we wanted to create moments and events where people can have a great time, but also raise awareness about this disease and share the hope there is in taking hands with communities and taking hands with people in the community that can support patients and also support the cause we have at the moment. I think the last thing that you asked, how can the medical fraternity be involved? For us, it's so important that people start talking about cystic fibrosis and the fact that there are actually medication available, but not everybody has access to it in South Africa. And we need more people to become aware of this. I think the people that are playing a role in getting it available and having patients get access to it, they are at it, they are doing that. But more people need to talk about this, because we can actually assist patients wherever they find they need more support as well.
Okay, thank you. The next is just a comment from Sylvia Malkin saying, thank you for a great presentation and sharing your personal experience. Much to learn from you. Take care. Thank you. So my question is actually a follow-up to what you just answered. So do you still need to travel to Argentina to get these drugs, or have you managed to get a different way to get them to the patients?
So we currently don't travel to Argentina anymore because it's way too expensive. There is an access plan in place currently. It's a lot cheaper, but it's still too expensive to afford for most patients in South Africa. The price tag is 400,000 Rand a year on that medication. And so there's still a huge amount of patients that doesn't have access to this because of the price. And so we don't have to travel anymore. And there is also news on the horizon that there's a generic becoming available, but that will not be in the next 12 months, just due to bioequivalence test that needs to be done still. So there are things happening, but it's a slow wheel that's turning.
Do medical aids pay for this?
Some medical aids do pay for it. I'm not sure if I'm able to actually say which ones. I think people can rather, because it's so complicated, you have to be on a specific plan and there's many exclusions on it. I think people can rather reach out to us or ask their CF specialist what would be best to do.
Okay. Okay, then I wrote down a couple of questions. Yeah, so if you're still in the audience and you want to ask a question, you can just type it there. My question was, you mentioned that some patients are diagnosed later in life. So how many of these patients are diagnosed later, and how much later? Is it like at 3 years old or 10 or 20 years? How much later do they get diagnosed, and why do you think they are misdiagnosed?
Hmm. So I'm not a medical expert,
Yeah.
but I knew do know some of the stats. I think most patients get diagnosed at the age of around 0 to 6 months.
Mm.
And so I think also if you think back about previous sessions we had with Dr. Zampoli, newborn screening is something that's quite important to address that as well. It will really make a huge difference, but that also comes with its own challenges within South Africa and being a third world country. Um, then just some patient stories I've heard and that have crossed my desk or yeah, with my interaction with patients, are that there are some patients that are only diagnosed at about 10 or 13. There's a few that's only being diagnosed at 20. I think the reason for it is sometimes they think it's asthma. Some of them have a history of being treated for asthma, and then there's also when they are diagnosed earlier, at least they don't only get diagnosed at 18 or so, but the earlier ones that gets diagnosed around about 7 to 10 often was treated for allergies or having celiac disease. I've also seen that. So I think these are the things to take note of, is that patients often present with allergies and similar symptoms that you find with celiac disease. And I think then they get treated for that, but not tested necessarily for cystic fibrosis. It is a rare disease. It's something, it's a genetic disease. And so the testing for it is also quite expensive, and not everybody can actually do the test. And I'm referring to the sweat test now. So getting diagnosed is not hard. It's just not available at every clinic.
Yeah, and so these patients that you have experience with, that you worked with, do they, I know you said you're not a medical professional, but just do they present with a constant cough? I think that's what you mentioned. So it's a
Yeah, I think
constant cough, and that's why it's treated as asthma or allergies.
you so there's multiple, I think multiple symptoms that the patient could have apart from chronically coughing. You might struggle with your bowel movements. There might be obstructions as well. You can struggle to pick up weight, and that's something that they pick up with babies as well. They have failure to thrive often. And another symptom is many patients actually taste salty because they in their sweat, so there's more salt being excreted. And those are the typical symptoms and signs that you might see. I hope I covered roughly everything. I think the other thing is people have sticky mucus as well that clogs up in their lungs and causes repeated lung infection in patients.
So the next question I have is more personal, and it might be a weird question, but I'm going to ask it in anyway. You talked about workforce and getting jobs, for cystic fibrosis. Do employers or others treat you as disabled, or is this characterized as disabled, or is it not?
Hmm. So I think it's important to stress and highlight that not all patients are as healthy as I am. And I think I definitely, I realize I'm one of few people that are actually able to work, and but there are a great percentage of the patients that do qualify as having a disability. So being being disabled or being categorized as having a disability is so much more than just being sick. There are things like how often you go to hospital, how often you are sick, but also can you actually walk, can you talk. And I think the thing we need to just note is that there's so many comorbidities going with CF, and there are patients that not only have CF, they might have CF, but also are on the autistic spectrum. And so then it becomes complicated. You can also have Down syndrome with cystic fibrosis. Obviously, those are the patients that are often being characterized as being disabled, and so they can also be employed accordingly. Me, however, I'm not disabled. I was able to go to university. I was in school. I'm able to participate in sports and things like that. Not without challenges, obviously. I also had all the symptoms that you have with CF, also had to get hospitalizations, had lots of hemoptysis and so forth. However, I'm really fortunate I'm able to work. I just think I'm very glad I am an occupational therapist, but in retrospect, it's the worst job to choose because you get in your training and going to work in hospitals, you get exposed to all those opportunistic diseases. So yes, that was quite catastrophic and a huge challenge I had to navigate when I studied, and not everybody understood that. I think, I had to fight with the health department because they wanted me. They said, let's not go into that. But in any case, the administrators in the health department didn't understand CF, I think, and they thought that they thought I'm discriminating against patients with TB, for example.
Sure. Yeah.
And I'm actually thinking about an example I really wanted to share with clinicians, and that's the one where I was lying in a general ward in hospital, and the next moment the patient came in who or was admitted who had TB. And I think that was one of the most stressful hospitalizations I ever had, because I thought I'm not going to get out of that hospital alive, just because that's the one thing I didn't want to get, as having CF already. And I think so. This is obviously much harder in state hospitals as well. But if possible, if a doctor can actually motivate to have a patient in a private room, that thing just prevents something like that from happening. I think to prevent cross-infection would really help a lot, and also it will decrease the amount of stress that a patient experiences while being hospitalized.
Oh, yes. Okay. Things that we don't really think about. I see there's no other questions. So just for the researchers out there, I have to also ask this. So the CF community isn't that large. It's rare. It's only a few hundred people. How open are these people for participating in research? Do they see it as they are a guinea pig, or do they see it as, if I participate, it might help future patients with CF, or how do they see research in their opinion?
So in my contact with patients from abroad versus patients from South Africa, there's actually a huge difference. I have seen patients from abroad and have talked to them online, and they are very much open to doing research because it might help somebody else. There are also people and patients in South Africa that feel that way, but I find they are a little bit less. And in general, there's two things that comes up when I talk to patients. Patients don't feel like doing another test or being treated like another guinea pig. I want to actually elaborate on that. And that's the thing that we've often had to take medication to see if it helps, and then it doesn't help at all, and we are left with some bad symptoms or side effects actually. And I think patients have become very actually afraid of that, of another side of having to cope with another side effect. I think that's the one thing, and that's with regards to medical treatment. However, there's still a lot of people that would be happy to try any treatment if there's sufficient information that it actually will make a difference. But I think side effects plays a crucial role when it comes to that. And if and then just my own personal experience, it's better if the doctor or the specialist actually says, Marie, I think this is really worth it, this, and then motivates it to me or to the patient. Generally, we've had so many people that come to us to say, I know this can make a difference. And now I'm talking about stuff that's really not even medical. People would say, take this herb and that herb and I don't know what else. And in the end, we tend to only trust our specialists. And also, we often, and I think I'm going to talk for myself now. Often in the past, I've went to other doctors to get treatment just because my specialist might be a little bit out of town or whatever. And I know other patients sometimes have to travel 8 hours to this specialist. So obviously, when you're sick, you can't travel 8 hours. And what I want to say there is that often it's really hard finding a specialist who's got expertise and knowledge and skills on treating CF. So it's hard to find a specialist who can really help you and guide you with the most effective treatment for you or treatment plan for you as a patient self. And I think as part of that, it plays a role. It also depends on your comorbidities and other diagnoses you might have and other challenges you might have, because it's such a multi-organ disease and multiple organs that can be affected. So it's really hard for people to participate when there's just another thing that might have side effects. I think that's with regards to treatment. But I think in general, if it's explained, and when I have explained to patients that this could actually help another patient, then they are willing to do it. But it needs to be explained, I think, and there needs to be time for it, and there needs to be an in-depth personal I think conversation about it. I hope this helps.
Yes, I think just from a researcher's perspective, it's not all research is focused, it's not clinical trial. Clinical trials is not the only research. I'm thinking of if these patients have genetic confirmation or not, if they have done genome sequences to see if their drug metabolizing genes are also affected, to tailor their treatment dosages, for example. So develop new and better point of care diagnostic testing that can be cheaper. So I think there's a lot of options, even in South Africa currently, to look at research that's not clinical trials.
Yes.
In those cases, I know patients would prefer, if they need to give a sample, a blood sample, a sweat sample, whatever, they would prefer to do it when they have to do it in any case and not go for that extra, collection or whatever.
Definitely,
So, yeah.
I think it's important to summarize the benefits for the patient in that case, especially financially is one of the examples that you've mentioned as well. The financial benefits there might be for them and other patients in the future with regards to effectiveness of treatment. And then also, for me personally, if I can help another patient by giving an extra sample of blood while I'm, in any case, getting blood work done. And that's done routinely on us patients. I think that's the way to go.
Okay. We are out of time. This was wonderful. There's another comment from Joanne Olivier saying, thank you, Marie, for an excellent and very informative talk. I think people are in awe. They all stayed until the end to listen to these conversations. I think we will, with your permission, share this on YouTube afterwards, because I know there's a lot of people who told me that they couldn't make it tonight, but they would love to see the recording. So for the audience members also, thank you for joining tonight. Thank you for taking time. Please, I think, Alna, you can correct me, but there will be a pop-up asking you to rate this just for the sake of the CPD evaluations. But otherwise, Marie, again, thank you very, very much for taking your time. It's as a researcher, we take time to prepare and we read up on stuff, and it's time to prepare. But for you, it's much more. It's your own life that you are actually, I don't want to say exploiting, but your own life that you are discussing so openly So I think it's not just time and effort, but it's really an emotional thing for you as well. So thank you very, very much. We really, really appreciate it. So for everyone, please go to Breathtaking Fundraising's website again and go and look at all the things they do. You also have a Facebook page that's quite active. So if you want to see what they do, please go follow them on Facebook and you will see all the great work they do. Okay. Thank you very much. Enjoy the rest of your evening. There's a few hand claps and loves in the chat for you. Okay. Thank you very much.
Thank you.
Yeah, we appreciate it. Enjoy it. Oh, there's a hand that's raised. Oh no, it's not. I think it was just a high five. Okay. Thanks everyone. Enjoy your evening. Bye.
Bye.